Good afternoon, Madam Chairs and committee members. Thank you for hearing my testimony. My name is Dr. Carol Allen. I'm a pediatrician with 40 years practice experience, testifying on behalf of the Massachusetts chapter of the American Academy of Pediatrics in strong support of House Bill 140. As a trustee of the Massachusetts Medical Society, I am also asked to say that the Medical Society would like to be recorded in support of this bill too. The evidence is clear. LGBTQ children and adolescents do best when supported by caring adults, especially their parents. When they experience rejection, they are at high risk for depression, suicide, and self-harming behaviors. The American Academy of Pediatrics is opposed to conversion therapy, stating, I quote, "Referral for conversion or reparative therapy is never indicated. It is not effective and may be harmful to LGBTQ individuals by increasing internalized stigma, distress, and depression." I am also speaking to you as a parent. I still vividly recall the day in 1992 when my husband and I discovered that our older son was gay. Despite obvious clues, we were blindsided and struggled to adjust our expectations about who he was and what lay in his future. A year or so later, his younger sister experienced suicidal thoughts and later came out as lesbian. Both times, there was a lot of family anguish and hard work to deal with our new reality, but we emerged from it with stronger relationships than ever. And 3 years ago, that younger sibling, who's now 38, transitioned to his true identity as a man. We are so proud of both our children and the productive lives they have crafted for themselves, their spouses, and their children. I tell you this story so that you can understand that parents may be caught off guard when a child comes out as lesbian, gay, bisexual, transgender, queer, or questioning. Parents love their children and will be searching for answers on navigating this new reality. The kids, in turn, crave and need their parents' love. They are looking to please them, but also to find their own identity. That charlatans will take advantage of the vulnerabilities of both parents and children based upon their own homophobic ideologies or possibly even mercenary motives is abhorrent and dangerous. House Bill 140 will prevent significant emotional harm to young people and families, and it will save lives. Similar legislation has been passed in 15 states and the District of Columbia. I urge you in the strongest terms not to delay any further its passage in Massachusetts.
Thank you. Thank you very much for your testimony and sharing your own story.
Good morning, Chairs Chang Diaz and Chair.
To pull the microphone closer.
Is that better? Good morning, Chairs Chang Diaz and Chairs Khan and members of the committee. Thank you for the opportunity to testify this morning in strong support of House Bill 140. As you know, this legislation seeks to ban the deceptive and harmful practices of conversion therapy by healthcare providers with youth under the age of 18. My name is Dr. Catherine Thompson. I'm here today as a licensed clinical psychologist from Boston Children's Hospital, also one of the lead organizations of the Children's Mental Health Campaign. We support this legislation because we know that so-called conversion therapies are bad for kids. In addition to my role as attending psychologist on the psychiatry consultation service at Boston Children's Hospital, I'm an instructor in psychiatry at Harvard Medical School. I'm the co-chair of the BCH Rainbow Consortium on Sexual and Gender Diversity. I run BCH's Safe Zone training, which is a training on gender and sexuality awareness for our employees. And I also see patients in private practice, and the vast majority of my patients identify as LGBT youth. And last, but I think certainly not least, I'm a parent and I identify as a queer woman. My wife and my amazing kid are the loves of my life. I want to talk to you about 3 things today. First, conversion therapies do not work. As we've said here today, they've been disavowed by all major medical and mental health associations. In fact, the American Psychiatric Association has publicly condemned conversion therapies for over 20 years at this point. Many evidence-based therapies and approaches to support young people who are questioning their gender and sexuality exist. I am happy to provide you with literature to back this up. One example of an evidence-based approach in working with gender and sexuality minority youth, or those questioning their gender and sexuality, is right at Boston Children's Hospital and the Gender Management Service, where a well-trained and affirming interdisciplinary team of medical and mental health professionals guide youth through this process of identity formation. It's important to highlight here that supporters of conversion therapy often point to a very small number of anecdotal studies. I probably don't have to tell you that the gold standard to establish evidence-based practices in medicine, psychiatry, psychology has to include randomized controlled trials. The studies quoted in support of conversion therapies are fraught with bias. They are not based on rigorous methodology, and they rely on retrospective data. Number two, not only are conversion therapies ineffective, they are truly harmful, and we have evidence to prove this now. There are a number of studies in peer-reviewed journals that show associations with negative long-term outcomes, including increased depression, anxiety, suicidality, emotionally dissatisfying relationships, poor self-esteem, and long-term sexual dysfunction.
So I apologize. I'm going to have, if you could maybe hand in your testimony.
Very
that would be
quickly,
great.
yes. The third thing I want to say is being gay, being trans, being queer, and being gender diverse is not a problem. It is not a disease. It does not need to be fixed. Gender and sexual minority individuals are not inherently at risk for negative outcomes. When we support these youth in our schools, communities, hospitals, they do well, and they do just as well as cisgender and heterosexual youth. We have been in Massachusetts, we've long been a leader in LGBTQ rights, and there are many things we get right, and it's time to pass this legislation and take the lead.
Great. Thank you very much for your testimony. Are there any questions?
Yes, Madam Chair, I have a question. So to either of the doctors, could you describe some of the practices in conversion therapy that you've seen that have led directly to some of these harmful results that you referenced?
Yeah, generally they focus on trying to change someone's mind about their sexuality or their gender identity in a way that, in support of talk-based therapy that would use strategies, evidence-based strategies like cognitive behavioral therapy, would use strategies like motivational interviewing to let the patient take the lead on their own identity formation rather than instructing someone on how to get rid of their sexual orientation or gender identity.
I would say that I'm not familiar with actually what happens at conversion therapy so much as it is a form of rejection from the parent, and there are good studies to show that it's acceptance that leads to successful growing up for these kids. That, as she mentioned, that when a child is rejected by the parent or feels that way, because and I think if they're referred to be converted, they would feel that way. Those are the kids who are at risk for suicide and for depression and for harming themselves and engaging in all kinds of behaviors that are harmful. But kids who are supported do great, and we have good documentation of that.
Thank you.
Yes, sure.
Can I just ask, can you specifically on talk therapy, so do you support talk therapy as part of conversion?
It's partly a semantics thing. The umbrella of talk therapy includes lots of things because the mechanism of therapy includes talk. So some people use talk therapy to describe things like cognitive behavioral therapy. Some people use talk-based therapy to describe non-evidence-based strategies for therapy.
Just because some of my concerns around this particular piece of legislation is in that section of talk therapy, some of the exemptions and things like that I'm just concerned about. I was kind of wondering when I heard you say that when you're in favor of it. I just want to make sure I understand your definition of it so I can educate myself on it.
Yeah, so I would say the talk-based therapy includes evidence-based strategies like cognitive behavioral therapy.
Okay, thank you very much. Thank you, Madam Chair.
Thank you again.
Madam Chair, I have one question. So you talked about credible and rigorous studies as a public health person, I understand what you're describing there. To your knowledge, are there any credible and rigorous studies that report on the percentage of people who are transgender who decide to go back to the gender that they were assigned at birth?
I think the numbers are very, I don't know, I can't answer exactly, but the numbers are very low of kids who have been helped through, at whatever age, through to become the person that they feel that they are. Very, very few either regret it or go back the other way. I'm sorry, I don't have the actual numbers.
The important thing that I would add there is that in all research, it's important to define exactly what we mean by that. So it's very normal for kids of many ages to have periods of questioning their gender or their sexuality. And some of those studies report very high numbers of people changing their minds because they may be reporting on periods of time where we would expect all kids to question gender and sexuality at periods of time.
Great, thank you.
Yes.
I just wanted to quickly add thank you. Parent to parent, I love my mom, I love my dad. I would never want to trade them or their support in for anything. But I could only wish that every LGBTQ person in our Commonwealth and country had the supportive parents like you two I know are for your kids. I don't have that magic wand. I can't make that happen overnight. Parenting's the hardest job I think any of us have ever seeked to explore. But when it comes to loving your kids unconditionally, I really appreciate what you're doing for your kids, and I can only wish it across the Commonwealth.
Thank you.
It is a process, and it does, and that's why it's really important that we support the parents with credible options, because they're not going to automatically necessarily be accepting that first moment. I certainly had to go through some transition or some evolution, I would call it. So thank you.
Thank you. Thank you very much.